I have PTSD from serving my country. All I want to do is go back to Iraq to feel normal again.
I have PTSD from sexual assault trauma, and I'm worried that because of it, I won't ever be able to have a normal relationship.
I have PTSD and have nightmares every night, so I avoid sleeping as much as possible.
Today I was diagnosed with PTSD. Now I'm feeling more anxious and depressed about it. I'm not looking forward to the stigma that comes along with it.
I live with PTSD from Iraq every day. Nobody knows, they just think I'm antisocial, boring, and a bit strange.
I can't keep a relationship going because of my PTSD. There's gotta be a girl out there who's willing to look past it for me.
I have PTSD, and when people find out, they ask where I served. When I tell them I wasn't in the military, they dismiss it like I'm lying.
I have severe PTSD, but I'm afraid to get the diagnosis. I don't want a label, a handout, or sympathy. I just want help.
I secretly live with post-traumatic stress disorder. I try to act carefree, but I live on alert.
I hate it when my PTSD acts up, and I'm suddenly afraid of everyone.
My trust issues make everything so hard, and I wish I could just forget my past. But my PTSD makes it impossible.
My ex left me because I have PTSD and wouldn't open up about my deployment.
My PTSD makes me feel alone and unwanted, which makes me angry at people.
PTSD has made me a prisoner in my own mind.
I thought my PTSD was getting better, but then the flashbacks started up again. I'm exhausted.
I have PTSD. My service dog saved my life. He gives me unconditional love and a reason to live.
Apa itu PTSD? PTSD merupakan satu reaksi emosi yang disebabkan oleh pengalaman atau peristiwa masa lalu yang traumatik, iaitu peristiwa menakutkan atau mengancam nyawa. Individu yang mengalami PTSD berupaya untuk mengalami semula peristiwa yang telah berlaku itu melalui mimpi dan sebagainya. Mereka biasanya ingin mengelak daripada mengalami peristiwa tersebut. Individu yang biasanya mengalami PTSD adalah individu yang bekerja di kawasan atau suasana yang terdedah dengan keadaan yang menakutkan. Sebagai contoh, askar yang terdedah dalam keadaan situasi perang, manakala doktor yang terdedah dengan situasi melihat kecederaan orang atau melihat darah. Jadi, bagaimana kita ingin mengetahui tentang PTSD? Jom kita lihat apakah simptom, intervention dan juga assessment mengenai PTSD.
Okay, so now I will introduce about the criterion that to diagnose this PTSD disorder. So a patient who suffer from PTSD disorder have to meet at least one or more of the following criteria from this criterion A. So for criterion A is someone who exposed to death, serious injury, or sexual violence in the following ways. The first is the person directly exposed to the event or witnesses the event or through the third party who was exposed to the trauma, and the last one is indirectly exposed to the aversive details of the trauma, which is normally happens for these professionals' duties such as doctors, nurses that will constantly expose themselves to the trauma event. So next criterion B which is intrusion symptoms. So the traumatic event is persistently re-experienced in the following ways. The first is unwanted upsetting memories. Second, through the nightmare. Third, flashback. Fourth, emotional distress after exposure to traumatic event. And the last one is physically reactivity after exposure to the traumatic event.
Criterion C, avoidance. Avoidance refers to the avoidance of reminders that is associated with the traumatic event, which is in two ways. First, trauma-related thoughts with feelings. It refers to thoughts, feelings, or physical sensation that brings up memories associated with the trauma event. Second, trauma-related external reminders. Okay, this refers to people, places, conversation, activities, objects or situation that brings up memories of the traumatic event. Okay, next next, criterion D, negative alteration in cognition and mood. It refers to negative changes in thoughts and mood that occurred or worsened following the experience of the traumatic event. So first, inability to recall key features of the trauma. Second, overly negative thoughts and assumptions about oneself or the world. Okay, next, exaggerated blame of self or others for causing the trauma. And then fourth, a negative emotional state such as shame, anger, or fear that is pervasive. Okay, next, decreased interest in activities. And then last but not least, the inability to experience positive emotions such as happiness, love, and joy. Okay, next, criterion E, alteration in arousal and reactivity. So at least two of the following changes in arousal that started or worsened following the experience of the traumatic event in following ways. Okay, first, irritability or aggressive behavior. And then second, impulsive or self-destructive behavior. Third, feeling constantly on guard. And then the fourth, difficulty concentrating, and the last, problem sleeping.
So what is the intervention for PTSD? First of all, we have cognitive behavioral therapy, which is CBT, that is focused on modifying a person's thought, behavior, and also their feeling that disturbing their daily functioning caused by trauma. Okay, and then the second one will be cognitive therapy, which is modifying the pessimistic evaluation and memories of trauma of the individual. Okay, and then the third one will be prolonged exposure. Prolonged exposure, which is teach the individual to gradually approach the trauma-related memory, feeling, and situation. So this could help them to know that the memories and the cue are not dangerous for them anymore. Okay, and then the fourth one is narrative exposure therapy, which is help individual establish a coherent life narrative. Alright. And then we also can use medication for individuals who have PTSD. So how to decide the intervention? We can use assessment. So there are a few assessments for PTSD. First of all, we have clinician administer PTSD skill for DSM-5. So basically CAPS, we have past week form, we have past month form, and also we have the worst month form. And then the second one will be life event checklist for DSM-5. Okay, and then we also have PTSD diagnostic skill for DSM-5. Last but not least, if an individual experience symptoms last for more than 1 month, and these symptoms create distress or functional impairment like in social or occupational, which are not due to medication, substances or other illness, then the individual might experiencing PTSD. Then the individual should immediately get consultation from the professional. Don't be shy to seek for help. Thank you.